Good afternoon, everyone. Thank you for joining us. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Office of Emergency Management, and Marlena Jackson, Interim Commissioner with the Milwaukee Health Department. County Executive Crowley, we'll start with you.
Well, thank you so much, Catherine, and good afternoon to everybody. As I've said numerous of times on this briefing, my vision for the community is stronger together, and I truly believe this. We're battling dueling pandemics of COVID-19 and structural racism, and the efforts to address these problems can't be done in a silo. So the call for togetherness is especially critical right now as we talk about the equitable distribution of the COVID-19 vaccine. And we've heard Dr. Weston and Director Roche share data that about 60% of the vaccines that have been administered have been to white residents here in the state of Wisconsin. Yet we know that the virus has disproportionately impacted many communities of color. And so as we look at the next phases of vaccine distribution, we have to consider how we're making this information accessible and understandable for everyone, and ensuring that those communities hardest hit by COVID-19 have the opportunity to receive the vaccine. And so it's going to be, and honestly, it's up to all of us. And I don't just mean the people on this call, I mean everyone right here in Milwaukee County. Together, we must do our part to make sure our communities know where to go for information and feel informed about the vaccine. And so whether it's helping your grandparents register online, reminding members of your faith community to sign up to receive alerts about the vaccine, or driving a loved one to their vaccine appointment, whatever it is, together, we can all make a difference. And while Milwaukee County does not have a health department, we are committed to supporting our local health departments and health systems to ensure equitable and accessible vaccine distribution. And achieving our goal of vaccinating more residents is dependent on supply. So, while we're working with our local health systems and partners, we are planning, but we also want to be purposeful as more supply becomes available. So remember, together, we can create a stronger, more equitable Milwaukee County. And we can't stop this pandemic without the help of each and every single one of you. And so while much of the focus have been on vaccine recently, I want to remind folks about a tool that is yet another way to help stop the spread of COVID-19. And it's called the Wisconsin Exposure Notification app. I'm gonna say it again, the Wisconsin Exposure Notification app. And it can be downloaded from the Google Play Store, or you can enable this on your iPhone through the settings. And this is a smartphone app that was launched at the end of December. And what it does is it uses Bluetooth technology to exchange anonymous signals with other phones that are near it for at least 15 minutes. So if somebody who has the app tests positive for COVID-19, they can send an alert using that app to other phones that were next to it. And so this app is free. It takes seconds just to download or to enable on your phone settings. And lastly, I want to thank all the community members who submitted COVID-19 questions on my and the mayor's Facebook and Twitter pages. I want to encourage all of our residents to continue posting questions related to COVID on our social channels. We'll do our best to answer them and share resources on this call as we continue to do. So I just want to say thank you for joining us, and I'll hand it over to Mayor Barrett. Mayor.
Thank you very much, County Executive Crowley. And I want to begin by starting with some good news. We've had a lot of bad news over the last year when we are dealing with the COVID-19 pandemic, but I think a little good news is in order. And the good news is Wisconsin is now leading the nation in the number of COVID-19 vaccine shots being administered daily on a per capita basis. This increase is due in part to state vaccination clinics being built across the state, and also because of the improved communication with the federal government about how many vaccines will be received by our state every 2 weeks, which allows for better planning. One of our biggest complaints for the first few weeks was we just didn't know, the state didn't know, but there appears to be better coordination right now, and that's something very important. Wisconsin is now administering 6,170 shots per million residents each day. To put that in sort of a comparison, the next fastest state, Hawaii, is administering roughly 5,830 shots per million residents. So again, we are leading the pack among all 50 states when you look at the number of vaccines being administered daily on a per capita basis. Now, we know that we started out slowly, but I think now the path is really solid moving forward. I'm also pleased to share that our federally qualified health centers now have the vaccine that they need to serve the community. These are the centers, the community centers, like the 16th Street Health Center on the south side. There's a number of centers throughout the city of Milwaukee that really meet residents where they live. And I felt and others felt it was really, really important that we have vaccines in the neighborhoods where people go and are trusted and trust their healthcare professionals. And that is happening right in our neighborhood on the south side and on the north side. So what it means now is that these health centers are getting the vaccines that they need to meet our goal of ensuring equitable distribution of all Milwaukeeans. That's something that's important to me. And I think as we look at this pandemic, we all have to recognize that we're in this together. And so we have to make sure that all parts of our community are receiving the vaccine. We also know that the pandemic has caused a lot of economic hardship. And one of the things that we have been working on over the past 7 or 8 months is the distribution of funds to small businesses. Small businesses have been hit particularly hard. And with the help of the federal government, we were able to use our CARES Act money to have an economic impact in our community. So I want to share with you some good news about our Restart Grant program for local businesses. We've received a lot of positive feedback on the program and how it has helped businesses adapt to the pandemic, as well as retain jobs for employees. During our most recent round of the Restart Grant program, over half, 51% of our grants went to minority-owned small businesses in Milwaukee. Again, our goal has been to be equitable, to have these distributed throughout the entire city of Milwaukee. But if you look at all the different rounds of our grants, we've been able to distribute a total of 2,321 grants to local businesses here in the city of Milwaukee. The total amount of dollars dispersed through the program has totaled over $18.5 million to those businesses, to over 1,000 businesses. And with the support of these grants, businesses reported that they were able to retain more than 1,700 jobs, and in addition, actually create 200 jobs. So I'm very, very pleased with the work that's being done by our Department of City Development in distributing this money to help our businesses during this challenging time. So we've got the vaccines, we've got the grants going out, and of course the testing continues. And we saw a little upturn in the testing just yesterday, and I think that that's a good sign. As a reminder, testing of the Northwest and Southside Health Centers transitioned to the curative mobile team. The current hours are 9 a.m. to 2 p.m. Monday through Saturday. But on Monday, we had 841 people over at the ballpark at American Family Field. Northwest Health Center was closed and the Southside Health Center had 83. So we had 924 individuals. Strong recommendation again, if you're feeling symptoms or if you've been in contact with someone, get tested. It does not take long. It's basically less than 5 minutes most times of the day to get in and get out and get tested. In our continuing effort to share as much information and as much timely information as we can to as many people, I want to remind everyone that we will be hosting our first virtual COVID-19 vaccine town hall meeting tomorrow, February 10th at 6 p.m. I will be joining local health experts to address questions from the public, speak to your concerns, and lay out plans regarding COVID-19 vaccinations. Our aim is to separate the facts from the myths and to crush COVID-19 in Milwaukee. The meeting will be aired live with captioning on the City channel, live streamed on Facebook on the #MKE health page, and posted at milwaukee.gov/COVIDvax after the event. To join the meeting, residents should register online at milwaukee.gov/COVIDvax. Please take advantage of this opportunity to learn more and to make the most informed decisions for yourself and your family. And again, there's some myths out there. We're going to have health experts from the community who are going to address those myths so that people have the right information as we move forward. Finally, it's sort of hard to believe, but election season's on us already. I want to conclude my remarks by reminding everyone that our spring primary election is just around the corner. In-person voting for the 2021 spring primary takes place February 16th from 7 a.m. to 8 p.m. So it's next week. Remember, if you are voting in person, you must bring an acceptable photo ID and wear a mask. While you're voting, please maintain a 6-foot distance from others and wash your hands or use hand sanitizer immediately before and after. Early voting for the 2021 spring primary is also taking place in City Hall on the 5th floor from 8:30 a.m. to 4:30 p.m. until Thursday, February 11th. And on Friday, February 12th, early voting is available from 8:30 a.m. until 5 p.m. If you have chosen to vote by absentee ballot, you can drop off your ballot at any one of our 24/7 secure drop box locations throughout the city of Milwaukee up until 5 p.m. on election day. For the full list of those locations, please visit milwaukee.gov/election/voter-info. Make sure to request your absentee ballot by February 11th if you want one using the myvote.wi.gov website. And finally, additional information such as how to find your polling place is available online at milwaukee.gov/election or over the phone at 414-286-3491. So another election, more democracy, and we're continuing to fight this pandemic. With that, I'm going to turn it over to Dr. West.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we have had 96,007 confirmed cases of COVID-19 in our community and 1,033 individuals who died in Milwaukee County. And we'll have the updated vaccine numbers on our dashboard tomorrow. We continue to see a decline in cases as well as hospitalizations. Our death rate is still certainly higher than we would like, with about 4 people per day. On a positive note, our positivity rate continues to decline, now at about 6.5%. And generally speaking, we're moving in a good direction on most fronts. While we've certainly seen challenges with vaccine distribution around the state, there's been substantial progress in Wisconsin's speed of vaccine distribution, now one of the fastest vaccinating states in the country. And across the country, as in our county, there have been significant racial and ethnic disparities in the vaccine rollout. At the state as well as the local level, we're taking several steps in an effort to address this. One aspect has been prioritization of our federally qualified health centers, as well as public health departments as vaccine recipients, to ensure that more underserved populations are receiving the vaccine. This process continues to be refined and improved by the state as well. Additionally, we're working to specifically target underserved populations linked to specific governmental and community programs to facilitate vaccine availability to those populations. And furthermore, we continue to follow a data-driven approach and are working with municipalities on acquiring the data to better understand vaccine distribution in our county in order to guide our efforts and inform a model to understand how the vulnerability of a community impacts vaccine distribution. Each of these efforts continues to move forward, and we will keep a close eye on our equity data. On the supply front, we do see more vaccines coming down the pipeline. Johnson & Johnson last week submitted a request for emergency use authorization, or EUA, of their vaccine to the FDA. In their studies, Johnson & Johnson found an overall efficacy rate of about 66%. However, 85% effectiveness in preventing severe disease and an impressive 100% effectiveness in preventing hospitalizations and deaths in the population studied. And we'll be paying close attention to the AstraZeneca vaccine. There was a small study that showed some difficulties in containing the virus variant that was seen in South Africa. And speaking of variants, a new study out of the UK showed that the strain there may unfortunately be 35% more deadly than the conventional strain and up to 70% more contagious. And now, unfortunately, we have 2 people detected with this variant in Wisconsin, likely the tip of the iceberg. As we learn more and more about the different virus strains around the world, and each now found spreading in the United States, it reminds us that the same precautions still apply and still work with every variant that we've seen, that is masking, physical distancing, and avoiding groups. As for the vaccines that are currently available here, Moderna and Pfizer, they're extremely similar. They both have excellent performance with regard to safety as well as efficacy. So I would certainly take whichever one you're offered first. There's no need to kind of jockey to try to get one over the other. And importantly, you need to stick with the same vaccine type for both doses. So if you got Pfizer for your first dose, you have to also get Pfizer for your second dose, and the same for Moderna. And first and second doses should always be available at the same vaccination site. There's no reason you should ever be going from one vaccination site to the other. The same vaccination site that provides you the first dose should certainly have the supply and be providing you with the second dose as well. So with that, we'll continue to keep you informed as our vaccination distribution ramps up and new vaccines and certainly the new strains add complication and nuance to these processes. Thank you very much. Stay safe, and I will hand it to Commissioner Jackson.
Thank you, Dr. Weston. So today I want to first start with some of the just information regarding the Bucks safety plan that was submitted to the Milwaukee Health Department. So we did receive their formal plan, and it is currently being reviewed. I'm not going to go into the details of what the plan entails as it relates to actual numbers or capacity limits, but want to just assure you that we are working with the Bucks leadership and meeting with them regularly to make sure that the plan that we end up with, the final version, will be putting safety first. So as it relates to the City Health Department and our vaccination numbers for the week, the city this week will plan to vaccinate close to 5,800 individuals, and that is with both first and second doses with both Pfizer and Moderna. And wanted to just share, as Dr. Weston had just shared, as it relates to individuals coming in for their second dose, understanding that the way that our current allocation works, you will get whatever dose was your first dose. So if you receive Pfizer first, then your second dose would be Pfizer. If you've received Moderna as your first dose, then you would be receiving Moderna as your second dose here in the city. Also know that we are finalizing our mobile site locations and dates this week. And so more information will be coming in the next couple of weeks as to those efforts. Next, I want to address a couple of questions that have come in via our public through our mayor's office and other areas. So the first question is Milwaukee doing lab surveillance on the COVID variants? So that answer is yes. The City of Milwaukee Health Department is one of 3 labs in the state that are currently completing surveillance testing as it relates to the new variants. And as Dr. Weston has also shared, we have seen there have been 2 positive cases. Those have not been through the City of Milwaukee Health Department, though. Another question that has come in are what steps should people take to get in line for the vaccine? So if you are 65 or older and you have a primary care doctor, you first should reach out to your doctor. If you are reaching out and there is no appointments or vaccines available, or you don't have a primary care doctor, please go to milwaukee.gov/COVID-vax, or you can call 286-6800 for information on how to get scheduled with the Milwaukee Health Department, again, as we are doing vaccinations for the 65 plus group. Additionally to the Group 1A healthcare workers, our firefighters, police, and first responders. When you go to the website or when you call, you can both get information on general vaccine information, as well as a link to be able to schedule vaccines. So as we, or excuse me, schedule your vaccination. As we've shared in the past, the reality right now is that we continue to not have enough doses for everyone who wants to get vaccinated. So our schedules do fill up very quickly when we are able to open them. An additional question that had come up specific to that is there a time where the Milwaukee Health Department, as a routine practice, could say, at 5 o'clock, the schedule will be open, or every Monday at 8, the schedule will be open. So right now, unfortunately, because our vaccine delivery time can change throughout the day, the week, and even the time of day, we're not able to say every Tuesday or be routine in giving that communication out. When we receive the vaccine, and depending on how much we get, we're able to open up those schedules, and that can happen at multiple times during the week. We do know that the state has changed how they have asked local vaccinators to request vaccines. From 1 week to asking for a total of 2 weeks of vaccine. And we're grateful for that because it will help us to plan moving forward to see if we could do something a little bit more routine. But right now we just don't have that capability with how the vaccine is delivered. Last question there is, are there challenges in providing people with their second doses of vaccine? And I think what that question is getting to is the overall compliance. So individuals who come in once, are they coming in again to get that second dose? And first want to just share, we know that the first dose does provide some level of protection, understanding that both doses provides the most protection. So the problem with the 2 doses is obviously individuals have to come back, and that inherently just creates typical challenges of having to find space on your schedule again, make time to come in, whether that's getting off work or whatever problems there might be to just getting that second dose. And that's for all populations that we serve when it comes to scheduling a second dose. And so for the city of Milwaukee, the efforts that we're making to address that issue is to know that, number one, if you've received a vaccine at the Wisconsin Center, your first vaccine, then a week before you are due for your second vaccination, you will get an email that will prompt you to say, hey, you're due now for your second dose. Please go ahead to the health department website where you can then register for your second dose. Then additionally to that, we also have general information around individuals who have received their first dose and are in the process or needing to schedule their second, and they have not yet. And with those individuals, we are actually taking time to personally call those individuals who are due for their second shot, who have not yet scheduled, to make sure again that we are getting them on the schedule so that they can get their second dose. So that's all the information or all the questions I have. And I would just also want to, again, remind individuals, as the mayor has already shared, that the health department is hosting our first town hall on Facebook to address information regarding COVID, as well as hoping to address some of the hesitancy and myths around COVID. So it's a place where questions will be asked, and we're hoping to really break down some of those really difficult issues that certain communities face as it relates to getting the vaccine. So please go to milwaukee.gov COVID Vax to register for that. And with that, I will turn it back over to Catherine.
Thank you, Commissioner Jackson. Our first and only question at this time is from Sharon Bajenda with CBS 58, and it's for Dr. Weston and Commissioner Jackson. She asks, studies are saying that the B117 variant is already spreading rapidly in the US, even doubling every 10 days. Is this variant on track to be the predominant strain by March? What are the consequences if it becomes a predominant strain, and what should people do to protect themselves?
So I can start here. So the B117, or the UK variant, has 3 aspects that make it particularly concerning. So one is the increased transmissibility or contagiousness. It looks like it's up to 70% more transmissible than the conventional strain. Second is it does appear to have increased severity. It looks like up to 35% more deadly than the conventional strain that we've seen. And then there's some evidence, and this is preliminary, but that to come out of the UK in particular, where the strain is very widespread, that it may be able to evade some of the immune response as well. So all 3 of these together make it a very concerning strain. The transmissibility, the fact that it's almost twice as transmissible as the conventional strain, means that, as you ask in the question, it can very quickly take over and become the dominant strain. And with the timelines that we're seeing, that could potentially happen in the next 1 to 2 months. So starting in March, we might be seeing this becoming a more dominant strain and affecting or causing a new spike to come. And so we're really up against the timetable here to try to vaccinate people as fast as we can to blunt that spike as much as possible. Now that depends a lot on vaccine supply, but what we do have supply of and what we can do are alter our individual behaviors. So we can wear masks, we can continue to physical distance, we can continue to avoid groups. And we know that no matter what strain we've seen, whether it's the UK, Brazil, South Africa, all those strains are still prevented through physical distancing, through mask usage, and through avoiding groups. And so we need to continue to stay vigilant, especially with these strains looming as we fight to get vaccine out as fast as we can.
All right, it appears our next few questions may be for Commissioner Jackson. The first one is from Ben Wagner with WISN 12. He asks, when does the health department expect to make a decision on the Bucs safety plan? Also, have the Brewers submitted a similar safety plan to allow fans at American Family Field? And if so, where does that conversation stand with the city? Is it reasonable to expect limited fans for the start of the Brewers season?
So to the first question regarding the Bucs plan, so we do anticipate it's going to take a week or two to get the plan completely reviewed. As you might imagine, it is quite detailed and based off of the volume of individuals as well as the space that is currently being reviewed, it's going to take just a week or so. And that also includes the fact that we do have to go out and do site visits. It's a very complex space in the sense that there are lots of things going on, lots of opportunity for to mitigate lots of spaces there. So it will take just a little while. As it relates to the Brewers, we have not received a formal plan for Brewers for the spring season. So when we receive that, same process, understanding again that we do want to make sure that our goal and the work of the health department is to make sure that plans are safe, that they're complete and comprehensive. I think the question about, is it reasonable to expect limited fans? You know, we'd want to be optimistic, but again, knowing that our priority in the health department is to make sure that the plans are appropriate and safe for everyone involved. And then regarding other venues, so we received a number of additional plans, for example, the Milwaukee Art Museum, the Milwaukee Ballet. There have been a number of art venues that have submitted plans, as well as some other sports clubs. So we continue to review those plans. Again, understanding that it takes just some time because we do have to do site visits.
Thank you for tackling those questions. Our next question is from Gabrielle Mays with Fox 6. She's asking, or she says, one county says it will offer a drive-through clinic for those who qualify for the COVID-19 vaccine. Will Milwaukee County or the city of Milwaukee offer a drive-through clinic? If yes, when? If not, why?
So I can address the city of Milwaukee. So right now, we don't have an actual drive-through plan set up currently for a couple of reasons. Number one, we're still doing testing at our most available drive-through sites, meaning Miller Park or American Family Field, as well as our health clinics. As we look to transition to actual vaccinations in those spaces, we will look to explore that option again, and then understanding that to address the equity, the Milwaukee Health Department is working to really set up mobile sites. So those are sites where individuals can come close to their neighborhood, close to their places where they live to get vaccinated.
Sam Kramer with Fox 6 has several questions. The first is for Dr. Weston, and he's wondering if you can elaborate on what level of concern do you have in regard to our current numbers, which are trending in the right direction upon news that the B117 strain is now in Waukesha County.
So our numbers are trending in the right direction, but I think one thing we've learned over the last 10 months of this pandemic is that we're seeing a cycle. We see our numbers improve. And as a result of our numbers improve, we let up a little bit. We let up at an institutional level, we let up at an individual level, and become less vigilant. And when that happens, our numbers start to rise again. Now, we can combat that certainly by having the numbers be as low as possible. So we get in as good a starting point from cases, from hospitalizations, from percent positivity, as promising a starting point as we can to keep those numbers low. We also have a new tool now, the vaccine, that we can get out as fast as possible to blunt any sort of increase that we see. But of course, the threat, as you mentioned, is the new strain or the new strains. And that increased transmissibility will make it much more difficult than at any point in the last 10 months to control another spike and to control how that spike may affect our numbers, how that spike may affect our hospitalizations, and how that spike may affect deaths as well.
Thank you. The next question is from Tom Durian with TMJ4 and is for Commissioner Jackson. He says, has the PAPS Theater submitted a plan for their facility? Is there a specific plan for the president's visit and town hall?
So as of right now, we have not received the PAPS plan. So we will wait that. We know that it will be coming. And so we'll wait that and address when we get it.
Excellent. And he asks a follow-up question for Dr. Weston. State numbers show just shy of 34% for 65 and older have been vaccinated. Local Milwaukee County numbers around 15%. Why the disparity? Is it strictly the larger population or vaccine allocation or allotment?
So the vaccine allotment would certainly be a question for the state. I think the disparities that you mentioned there are certainly concerning. Population shouldn't have much of an effect on that because we're talking about percentages. So certainly we are hoping to get more vaccine supply to Milwaukee County, to each of our municipalities, so we can ramp up the vaccinations of our 65 plus population as soon as possible. And we certainly, I think the city, the county, the municipalities stand ready to receive vaccine and get it into willing arms as fast as we can.
Those are all the questions I'm seeing in the chat. At this time, I think we can conclude today's briefing. Thank you all for your time, and we'll see you on Thursday.
Thanks, everyone.
Thank you, everybody.
Thank you.